An appeal today from Minister of Health Terrence Deyalsingh for people who have been in contact with COVID-19 positive cases to cooperate with the Ministry of Health. The call came during Wednesday's Ministry of Health's virtual press conference. More in this report from Khrystal Wilson.
Trinidad and Tobago continue to increase, with 3 schools closed, the most recent, the St. Augustine South Government Primary, and a number of businesses and government agencies also ordered shut for sanitizing purposes. Health Minister Terrence Deyalsingh called on members of the public to cooperate with the ministry's contact tracing team. During Wednesday's COVID-19 virtual media update, the Health Minister said the tracing team have been encountering hostility from members of the public in their attempt to identify secondary and tertiary contacts.
Understand that some of the questions may be of a private and personal nature, but hostility and hanging up the phone is not the way to go. We understand we may be asking you how long you are living in a particular location. That may be deemed private, but it's important. We understand that when we are asking you who is your partner, your girlfriend, boyfriend, husband, wife, who are your close personal contacts, as far as your position is concerned, it's personal, and it is. But we are in the middle of a pandemic.
The Health Minister said when people are contacted, they are reluctant to share their addresses and identify their companions. He said the information, although personal in nature, is crucial to locating the source of the virus and preventing further spread. Meanwhile, Chief Medical Officer Dr. Roshan Parasram said investigations for contact tracing have so far determined that one of the local cases is linked to a person who entered the country without being detected. He added that the Ministry of National Security will be informed and an attempt will be made to locate the person.
We are relying heavily on the clinical history given to us by patients and their contacts. In some circumstances, we understand that there may be difficulty in recall. In order to assist, as Minister has indicated, with the ongoing tracking exercises, we ask patients and their contacts to be as forthcoming as possible with all information.
Dr. Parasram said, considering the gap in time between case number 116 in April 2020 and the recent local case in July 2020, this development is likely to be the start of a new phase of COVID-19 infections in Trinidad and Tobago. Khrystal Wilson, TTT News.
3 people remain quarantined in Tobago as a precaution to prevent the spread of COVID-19. At Wednesday's post-executive media briefing hosted by the THA, Acting County Medical Officer of Health Dr. Tiffany Hoyt gave an update on the 3 persons who had close contact with a positive COVID-19 patient.
Within 24 hours, they were identified and placed in quarantine by the surveillance unit and the contact tracers of the Office of the CMH of the division. All persons tested negative. Persons are currently in quarantine under 24-hour watch, and they continue to remain in good health.
Tobago has so far conducted 328 swabs for COVID-19. The island is now equipped with a PCR machine that can test 4 samples at a time. With a rise in cases in Trinidad, Dr. Hoyt appealed to members of the public to stringently adhere to COVID-19 protocols.
If you are ill, we are pleading with you, please stay home and call our hotline. Our hotline number is 800-HEAL, 800-4325. You will be attended to by a doctor who will direct you with respect to getting care and also with respect to getting tested.
Dr. Hoyt said the island is currently has the capacity of 7 beds designated for COVID-19, with plans to ramp up that number to 40 very soon.